All right. Good evening, ladies and gentlemen. Good evening, everyone. I want to especially welcome you to today's program on 30 minutes with me, Twitwi. It's 12 minutes past 5 already. We should have started since 5, but due to some technical challenges, but now we're here. So first, let's just take this break. All right. Welcome. Today we want to talk about face mask and every of these guidelines that comes with this particular period. So I have a professional, of course, Dr. Samuel Aladejare. Is a psychiatrist and he works with the Neuropsychiatric Center, yes, Psychiatric Hospital in Yaba. Good afternoon, sir.
Good afternoon, sir. Good evening. No,
Okay,
can you hear me?
Doctor, let's start with the whole thing about this period, the COVID-19. But before, sorry, I beg your pardon. Before we go into COVID-19, let's talk about mental health. What is mental health?
Okay. Thank you very much for having me. Thank you for inviting me. Like you rightly stated, I work with the Federal Neuropsychiatric Hospital Yaba, the famous Yaba left. And yes, so we deal with mental health, and mental health simply has to do with how the individual thinks, how he feels, that's emotions, their behavior. So those three things comprise mental health. Just like we all know that health is defined as a state of mental and social well-being, and not just the absence of illnesses. Same thing, mental health too is not just the absence of what we call psychopathologies, which are abnormalities of thoughts, of emotions and behavior. It also involves our general livelihood. It involves our well-being, involves how we are able to carry out the regular functions of life, whether we are able to love, we are able to work, whether we are able to fulfill our roles within the community the way that is expected. So it's not until somebody starts misbehaving, so to say, the way society will say, or you find somebody that is stripped naked and walking along the streets. It's not until someone gets into that condition that we say that the person has a mental health condition or needs the intervention of a mental health professional. So the ranges of illnesses, of diseases that we deal with, it's a spectrum from the very severe ones, which are mainly the psychosis, things like schizophrenia, like bipolar affective disorder, where we have mania when the person is so high, is described as very high, the person is very hyperactive, the person has irritable mood, the person is finding it difficult to sleep, is just doing a lot of excessive work. And then there's the other portion of depression where the person is really very low, is moody, the person weeps more all the time, is finding it difficult to sleep, blames himself. And then we have other conditions too in the middle. We have things like drug problem, people who are dependent on drugs, cannabis, cocaine, heroin, they also fall within our ambit. And then there are those that are seen as mild but are a problem nonetheless, like anxiety disorders, which many people battle with and actually constitute majority of the conditions that we deal with on a day-to-day basis. So when we say 1 in 4 persons in their lifetime are going to have disease, illness. We are not saying that everybody is going to, at one time or the other in their lives, and are going to strip naked. No, we are not. That's not what we are saying. We are saying that many of them, a lot of people actually, will have anxiety disorder during their life, because that's what majority have. And then there's also the part concerning children as well, which involves their development. They are being able to walk, control their neck on time. And then for adults too, for old age, which has to do mainly with memory problems, what we call dementia, Alzheimer's disease. Is dementia. They are forgetting things, forgetting about family members. So that is a summary of what we do and the kind of conditions that we manage. So when people come to us, there are three ways we manage them: with medications, with what we talk therapy, which we know as psychotherapy, and then we also have other modalities to social modalities, solving social problems that could have affected that could have caused the illness in the first place. Now coming down to the period we find ourselves. Am I allowed to, can I continue?
Yeah, no, go on, go on, go on. Yeah,
Okay,
we are
yes.
here
So
to learn from you. Yeah.
yes, okay, yeah, thank you. So COVID-19 has been a major challenge to everyone in the world. Every department of medicine has had to deal with COVID-19, and it's a disease still in evolution, and mental health is not left out. In fact, it is being said that when the acute illness, when the world is through dealing with the physical consequences of COVID-19, those of us in the mental health field, we have to deal with the remnants of whatever is left, because some of the emotional issues that will be caused by this problem, some of those issues are going to linger, and it will be left to psychiatrists, will be left to people in the mental health field to deal with the remnants of this problem. So we've had cities institute things like lockdown. We have things like social distancing being implemented. We have people having to test and wait for results. So all these things have psychological consequences on people. For instance, many people just feel caged with the lockdown. A lot of people feel caged, and then they will have preferred to move around, but now they can't move around. And when people find themselves in such conditions, it could worsen anxiety, like worsen anxiety, especially for people who are predisposed. So people who are already dealing with anxiety disorder may have it worsened by lockdowns, by stay-at-home
Just cut off.
orders that are being implemented. Also, we know that human beings are meant to be, we are meant to be social beings. We are social beings by nature. We love to see people, we love to talk to people, we love to touch, we love to hug, we love to do all those things, and those things enrich our humanity. They are the things that make us who we are as humans and different from animals. But when we talk of social distancing or physical distance, it has reduced the extent to which such things can take place. So it has its effect also on individuals. There are times when people find themselves in situations where they need people to reassure them, to tell them that everything is all right. They need a hug, they need somebody to hold their hands and tell them everything is all right. These things are not possible during this period because of COVID-19. And then it has also affected our work, in the sense that normally we would want to spend hours, up to an hour or more, with patients, to talk to them, to find out how they are doing, and then have other people bring in other intervention. But this has not been, we have had to limit these issues because of COVID-19. You know that the longer you spend with somebody, the higher the chances that droplets could go from one person to the next. So these are some of the ways in which COVID-19 has affected our practice, has affected mental illnesses generally. I think I should hold on here. May want to ask something before I move on.
Yeah. I like the fact that you just touched on how it has affected your profession, the practice, at the same patients, and all of the rest. But then again, one would want to ask, has there been an increase in the number of patients you receive usually since the outbreak of COVID-19 in Nigeria?
Okay, so I might not be able to provide a definite answer since I do not
Okay.
have more statistics to provide. But what I do know is, at the during the period of the lockdown, we part of what generally all medical professionals try to do is to discourage indiscriminate coming to hospitals, because we discovered that in certain countries, hospitals served as distribution centers for COVID-19. So we try to discourage people who may not need to come by giving them longer appointments so that they can stay at home. But then since it and then as much as possible, we try to diminish admissions as much as possible so that only those cases that are extremely necessary are taken in, and we don't overfill the wards, so that yes, social distancing can also be practiced on the wards where these patients will go to. But since the lockdown has been eased, a lot of people have actually come. A lot of people that couldn't come during those periods have come. But I would say that the traffic is still not like it used to be, because we still try to encourage as many people that can stay longer, who can just get their medications and stay longer without coming for appointment. We try to encourage them to do that so that social distancing we don't overflood the hospitals, and we don't end up becoming distribution centers to COVID-19 for COVID-19 in the country.
Oh, okay. Now, uh, that is very nice. It's expected anyway because we know it's one of the guidelines. But then again, let's look at the challenges again, because one of the things that comes with the lockdown has been financial issues. You know, people not making income, people struggling to eat, and all of the rest. So, okay, maybe before I go to that question, let me even ask: uh, was there anything, any form of orientation or message generally passed to reach out to the people on behavioral pattern during the lockdown, put together by the Psychiatrist Association?
Yes, at various levels, people have put together different psychiatric bodies, hospitals, associations. They've tried to put together messages that could help people deal with the psychological effects of the lockdown. And for as much as, even though the physical message about the physical condition and how to prevent it went ahead, but with time, these messages came along with it. We have, for instance, the Department of Behavioral Medicine, that's psychiatry in Lutz,
Yeah.
put together such a message. Then the Nigerian Association of Resident Doctors also had a message solely about psychological, how people could cope during this period. And then we also have organizations. We have non-governmental psychiatry organizations like ASIDO, ASIDO Foundation. They also had like a 7 minute video to teach people what to do, let people know what to expect during this period, and to know how they are going to cope with it. So there's a lot of those messages went out from different sources.
Oh, okay. So can you just give us some of the behavior, the things that are expected, uh, that was expected because the lockdown has been eased already, that was
Yeah.
expected of everyone during the lockdown, at least to cope mentally. Some of those activities that are expected to help encourage mental health.
Okay, yes. So we, starting from where I came, what some of the things I mentioned before, the messages usually would include what people are to expect during this period, like how they are likely to feel, that they are likely to become anxious, hearing news that the numbers keep increasing every day. When you see the red bar on the NCDC chart that shows deaths, and then you see that this number keeps increasing. When you think about it, that these people actually, they are humans, they are not just numbers that are listed here. These are people's relatives, fathers, sons, wives, and the rest of. So these are people that are known to one or two persons. So it's
Yeah.
possible that people might want to get anxious about that. And We know that some people could sit down with the TV, news after news about coronavirus. When you finish with Germany, you move to America, from America to UK to Nigeria, and you keep moving around gloomy messages everywhere. 100,000 today have died, 20,000 have died, and you keep seeing such. You know, with time, it could get to people and weigh them down. So some of the things we recommended then, one of the things we recommended was that people should limit their consumption of these stories. So limit the amount
Oh,
of time
okay.
you spend consuming this kind of stories. Restrict it to about 2 hours a day, for instance. And maybe you could schedule it maybe 40 minutes in the morning, 1 hour in the afternoon, and maybe just to update yourself and make sure that you know what is going on. But don't tarry before the TV watching this kind of things for too long, because it would obviously have negative effects. It could make you anxious, it could cause you to be depressed, make you very fearful, could make you feel hopeless that look, no matter what you do, or helpless, and no matter what you do, somehow this thing will still catch up with you. So that's one. And then another thing that was recommended is that people should set out time for exercise, because exercise, apart from what it does to the body physically, it also has effect on the brain. It has a feel good effect on the brain. It has a feel good effect on the mind. So it has a way of making you feel better. So we recommended that we encourage people to do exercise. We encourage people to do exercise. Set out time for exercise during the day so that you feel better, and then set out time also to get some meaningful work done, learn something new, learn a new game, learn a new skill, learn something on maybe one of these online teaching apps. So those are things, and then spend time with family, call people. Now, since you have extra time on your hand, can pick up your phone and call, let people know how you are doing, find out from, speak to friends that you've not spoken to in a long time. So as you reach out and you distract yourself in all these activities, you get your mind off this, you get your mind off the things that are happening, and you are able to, you are in a better condition to take charge of your life, take charge of your mind, your mental health, and you are healthier in that instance. Also, we encourage people who, for instance, have gone for tests and are waiting for the result of their test. We encourage them to as well also distract themselves in various activities. Read a book, play games, discuss with family members, do things that will take your mind off you so that you don't die before the result comes. And of course, we know that it's not a 100% fatality condition. It's within 1 to 3% in most countries. The number of people that end up dying. So you know that even if at the end of the day the person turns out positive, you know that it's 1 to 3% of the population that eventually die from it. So your chances are still not a death sentence, and you have a better chance if you keep your head high and keep going.
Oh, okay. Quite interesting. Then you've just spoken. I think what you've just said covered generally for everyone. But was there any particular activity or advice to parents on helping children? Because I know for me personally, I can tell there was a time I discovered the children were boring. It was becoming boring for them, and it's like
Mhm.
same activity every day. There's nowhere. So my daughter will ask questions repeatedly. So, were there advice directly to parents on how, on what to do to help children, at least for children who are wise enough to understand that this is unusual?
Yes, there were messages that were also released, mainly from the World Health Organization, and then from different psychiatry body. For instance, I know that the psychiatry department in University College Hospital Ibadan released a message for children, released a message to parents on how to deal with children, cope with their children during that period. And some of the things they said, yes, like you mentioned, children could be curious to know, want to know what's going on. So you may have to sit down and explain to them that this is what is going on. And then, yes, they could get bored. So because they could get bored, you have to involve them in activities, family activities, play games together, do things together. You could even dance together. So, and then, so those are some of the things you could do. Help them with books, bring out books that they could read during that period. If they could play games, let there be periods, defined periods when they could play those games. So let there be a mixture of activity. And there was a whole manual that described how parents could cope with their children at home during that period.
Oh, okay. Now let's look at the COVID effects. How, judging by your profession and experience generally, not just about pandemic, but in cases of war and other crises, what should we expect post-COVID? Talking about mentally, the approach, how this would have changed behavioral patterns and every of Nigerians. What are the projections post-COVID?
Thank you. So, like you mentioned, whatever I'll be saying will be based on experiences of the past, how
Yeah.
society has managed to cope after conditions like wars and diseases that have happened in the past. Because, yeah, apparently I'm not God, and I don't have a crystal ball that is really
Yeah.
front of me. But what we know and what we expect is that, like I mentioned earlier, that when the world is through with the physical condition, the issue of the mind will be there to deal with. Anxiety is expected to rise. Anxiety is expected to rise. We expect that a lot of people will come down with anxiety disorders. We are telling people to wash their hands after touching this, wash their hand after touching that. That practice is not likely to go easily. Yes, it may be a good practice, but it could become a problem if it occupies a person's life and begins to affect productivity. For instance, imagine rather than you sitting down in your office, rather than you sitting down in a studio, carrying out broadcasting, you are spending all the time at a tap, you are washing your hands, you come in,
Yeah.
you go
Yeah.
back again to wash your hand, you come in without doing it, and you keep doing that. So that's a compulsion. That's from obsessive compulsive disorder. And we expect to find some things like that. We expect that it would increase. Of course, during the lockdown periods and during this period, some of the mechanism that some people had coped was to use drugs. So when they feel that everything is gloomy all around them, they try to brighten their day by coping in a very wrong way by using drugs, alcohol, and all that. So we expect that substance use conditions too are likely to increase based on sometime after this. And of course, this is already affecting. I mentioned earlier that psychopathologies, which are our own, I would describe, which are ways that we identify that people have mental illnesses. This condition is already beginning to affect many of these psychopathologies. So you will find somebody saying that he or she has the cure to coronavirus as part of the illness, that he has a cure and wants to give it to the world, and nobody wants to allow him, and the person is going overboard. And so we
Yeah.
are already beginning to see things like that, and we expect that a lot of it will increase. And of course, our social interaction, we expect that to affect it because, for instance, a lot of people are still going to be skeptical about attending whatever happens. A lot of people are still going to be skeptical about attending maybe big occasions, ceremonies with a lot of people, weddings. A lot of people are still going to be very fearful that they wouldn't want to attend such things, that maybe this thing will still be there. So it will be difficult to rewire people's brain over time. It may take some time to rewire people's brain to become to become social again, like we were supposed to be. It will be difficult to make that happen over time. So these are some of the things that we expect. Adjustment disorders, that it will take time for people to adjust to what has happened. And then we are not yet too sure about the long-term effects of this condition, especially on the brain. We are not yet too sure about it. So it's still a disease in evolution, and we are studying it over time. We hope that there will not be long-term effects on people's brain, that we may have to start studying, maybe it could cause other mental health conditions in the future. We hope not, but these are possibilities of what is likely to happen in future.
Okay. Quite interesting. I like the fact that you touched on the fact that we are not really sure if there's going to be a long-term effect. Uh, but one of the things, if we judge from some of the things you've talked about, talking about conditions that that are considered unhealthy that can lead to mental illness. That is talking about anxiety, stress, and other. You mentioned the bipolar disorder and all of the rest. So, one of the things we cannot take away as the effect of COVID-19, even during the lockdown, has been depression. One being depression. People
Mhm.
are so anxious at some particular time. So, if these are some of the factors that are considered as mental disorder, so are these things not likely to linger even after the entire COVID, even perhaps after COVID-19 might be announced as gone forever?
Yes, it's possible. It's possible these things might be there. It's possible these things might stay for a while. We expect that a lot of people will have lost a lot. Um, People have lost a lot as well, not just on the health side. Financially, effects of lockdown, businesses have gone down, people have lost jobs. So we expect that these things are still going to the emotional consequences are still going to linger for a while. Like I mentioned earlier, that when the world is through with the physical consequences, we will still have the mental health consequences. And depression is part of what we expect that will be there. And then suicide is another thing that because many people are going to feel like everything that they have is gone, they don't have anything. How are they going to cope? So those are, and then they might start thinking of ways to end it. So those are things that are likely to linger for a while after after the condition is eliminated.
Okay, yeah, I was going to ask something on suicide, but at some point I thought maybe uh, it might be too early a period to start talking about that. But then, now that you touched on it, knowing fully well what happened last year in this country, maybe due to awareness and the announcement, we could say that we saw. I'm not really sure if that is the case, but the number of suicides that was reported in Nigeria, in fact, it was like unprecedented. Maybe not that we don't usually have suicidal cases, but maybe not as widely as reported as it was last year. So now that we have the lockdown, financial loss, job loss, and all of the rest, what are those things you think can be put in place, at least, to help people deal with the mental implication of all of these cases, from the losses, financial loss, job loss, and all of the rest?
All right, thank you. Yes, I like the fact that you said that we are not sure whether there was actually an increase, but we knew, but one thing I was sure there was an increase in reporting, and
Yes.
that might have affected a lot because we are aware of something called with weather effects. Weather effects is more or less like a copycat suicide, whereby because you heard that a popular person died by suicide using a particular method, everybody starts copying that particular method. So it's one of the reasons why in reporting of suicide by journalists, we encourage media personalities that when they report suicide, there is a pattern, there is a way it should be reported. So it shouldn't be while reporting, it shouldn't talk about so person died by suicide, for instance, by hanging or by drinking so. It shouldn't make it look like the family members are already in enough pain. They're already having their own guilt that maybe they may be responsible because they had not done enough for the person. So you shouldn't report in a way that makes them look bad, make them look like they are responsible for it. They already have enough guilt. You shouldn't worsen the guilt. And then we encourage that whatever you do, you should balance the story. So if, for instance, you report that somebody died by suicide, by maybe hanging or died by suicide, you should also balance the story by saying it's also possible that there are people who have had the same problem that the person had and they sought help and they got better and they are living life very well and everything is fine for them so that people in that condition can know that there is hope for them and they don't have to follow the path that others are following. So it's not impossible that the manner in which the media handled these stories must have increased it. But then we cannot be sure, like you mentioned, we cannot be sure whether it was an increase in suicide rate or it was an increase in reporting. So now, what can we do to ensure that more people do not find themselves in this position going forward, considering that a lot of factors are on ground to make it happen? Part of what can be done is that there has to be people have to generally now people have to be there for their people. You have to be there for your family members. You have to talk to them regularly. You have to contact them regularly. Make sure you speak to them on a regular basis to know what they are going through, to be available for them in whatever, even if it's just to offer encouraging words that could be of help to them. We should do that. Also, we can be our brother's keeper, like it's being touted everywhere. That if you know someone who is in need and you have even just enough for yourself and just a little more than enough for yourself, you can share with those people to also relieve them and help them. That's on the individual level. And then on the part of government, some of the things government is doing, putting on stimulus packages for businesses, tax breaks, giving tax breaks, giving incentives to businesses, giving funds, holding meetings with corporate organizations to discourage them from sacking, from laying off workers. So those things are going to help to keep a lot of people afloat. And if it helps to keep them afloat, then they may not go this way. Yes, providing loans also for individuals, for small businesses that have gone down so that they can pick it up again and they can get it rolling. And then there's also the part of people encouraging people using more mental health facilities, using mental help as much as possible, contacting professionals. If you feel that you find yourself in this condition, contact professionals. So this is another place where government could be of help. If you consider that these people have lost money and lost a lot of things that they cannot afford these services, government might need to invest more in the field of mental health, might need to invest more in terms of expanding the workforce, creating places, avenues where people could easily walk in, friendly centers, mental health friendly centers where people could easily walk in and seek mental help, get counseling, have lines available where people can call in. And these things may not be easy for individuals to do, but government can take up this role to have to let more people have access to mental health services. So these are some things that can be done to reduce the psychosocial effects of what has happened already, to mitigate the effect and ensure that people are not taking their lives. And then you need to have messages out there, a lot of messages of hope to encourage people to use mental health facilities if they feel unwell, if they think that they need help, that they should seek help. So we need more of these messages out there for people to know that this help is available and they don't need to take their lives in the midst of all this. And then, yes, religious organizations also need to spread hope as much as possible. Let people know that if life is like a swing, if it goes up, if it goes down at some point, to surely go back up later on. So the sun will surely shine again. So you don't have to assume that everything is over. If it comes down now, it's going to go back up. It's just like oil price. Oil price went as low as negative. It's on the rise again. It's $35. I think as of yesterday when I checked. So it's on the
Yes.
rise again. Let people know that things will pick up with time.
Oh, okay. Now, lastly, now, or second to last now, let me
Yeah.
ask: uh, do we have enough professionals, mental health professionals, in the country to help? Should we have increase in number of those not with mental disorder, not just necessarily with mental disorder, but if people need help, those who need help, who want to seek counsel and all of this, do we have enough professionals to handle both those that might need treatment or and those that need counseling? Do we really have enough in the country?
The answer to that question is no. The people who will be available for treatment, you have psychiatrists, you have psychologists, occupational therapists, social workers. So it's a team work, and even psychiatric nurses. And at every level, each of them, there is We have gross understaffing at every level in terms of psychiatrists, those that are registered with the Association of Psychiatrists of Nigeria. You have just about 200 registered for the entire country, and I can assure you not all those that are registered are still within the country because people keep leaving every year. Same thing for resident doctors like me. A lot of people keep leaving, they don't even finish the program. Psychologists are grossly they are grossly understaffed as well. They are not enough. Psychiatric nurses are not enough. So it's important that government invest massively in this, employing more of these people into government facilities and even into communities, engaging in community psychiatry, and instituting, making psychiatry a part and parcel of the services rendered at our general hospital level. So it will create more opportunities. More people can use those facilities there rather than everybody coming down to a tertiary psychiatry facility like the Federal Neuropsychiatric Hospital in Yaba.
Oh, okay. Wow. You've touched on the last one, really. I was going to ask about the budget that you get at your place and even generally for centers, neuropsychiatric centers across the country. I know we have in Lagos and Edo, in even Abeokuta and some other places like that. So that means already at the moment they are not, the budget is not really adequate enough to cater for, at least to render the needed service.
No, it's not enough.
Okay.
It's not enough at all.
Okay. And I also understand that the service is very expensive. How true?
Not exactly.
For those seeking for treatment.
Not exactly. For instance, if for those seeking treatment in the government facility, I will speak for Federal Neuropsychiatric Hospital Yaba, for instance. If you are coming for the first time, your registration fee, there's registration fee for 4,000 naira. Without 4,000 naira, 2 basic investigations will also be done. And after your consultation with the doctor, you will be given medications. You have to buy medications. So usually by the time you spend about 12,000 naira, by the time you spend 12,000 naira, you are able to, in most averagely, you are able to get medications that would last for up to 2 weeks, at least to start with, or even up to a month. So it's not that expensive. But then if you need admission at Federal Neuropsychiatric Hospital Yaba is usually for 2 months. And for 2 months, the fee is 100,000 naira for 2 months. And that will cover feeding, it cover feeding, cover medications, although you may still have to make more deposit for medication as time goes on. But if you compare that to elsewhere, you know that it's not that expensive. Yes, seeking private psychiatric service could be very expensive because, like I mentioned, it's a very scarce service. You don't have enough of them, so it's quite expensive on the private side.
Okay. Wow. I want to say thank you very much. We've stayed longer than the 30 minutes already. So much to talk about. But I know we've really touched basically on some of the angle we should talk about, which is about COVID-19 going forward, and of course the impact it will leave with us mentally. I hope I'm mentally fit. What do you think?
Well, like I said, if you're able to perform your regular everyday function, you're able to come to work, you're able to love, you're able to
But to
contribute
love
meaningfully
is also
yeah,
important.
to love is also very important. Yes, it's also one way that we assess whether you are mentally fit. You're able to contribute meaningfully to your society, you're able to achieve your goals and aspire to, you're able to live a meaningful life generally. If you're able to do that, well, you can say that you are mentally fit.
Okay. Thinking about it, am I able to love? I think so. I think I passed on that. Yeah.
Yeah.
but for work, I don't know. I don't know what it's going to be going forward because I think a lot of things will change. But I just hope that
Mhm.
will not pass as a disorder, though,
Yeah,
because
well,
some of us are getting used to working from home now, and it's
of
going to
course.
like feel strange,
Mm-hmm.
driving the long hours in traffic, going to work again
Mm-hmm.
and the rest. So yeah.
Yeah, yeah, yeah. I agree with you.
So yeah, then on your own end, on your profession, can you actually have a virtual counseling or examination of patients?
Well, we are in a time when everybody has to be inventful. You have to be innovative at this
Yeah.
time. A lot of things that we felt were not possible virtually are now possible. Churches are even holding services virtually. So
Yeah.
if that is possible, I think every other thing is possible. So yes, we can do teleconferencing, we can do online consultations, and we can do all that. With the situation demands it. So we have no choice.
Okay, so that means by looking at me virtually, there are ways you can actually assess me to know if I have any challenge or the other. Are there
Yes,
things, questions you will ask? Or
yes, of course, there are questions I will ask, and then based on your responses, observing your body language, I can say whether everything is all right, or you need just a little more. You need some tweaking to it.
okay, maybe we should just take a short break. We'll come back and I'll let you do a 1 or 2 minutes counseling
All
with
right.
me. Just ask questions so that at least I know there are people who are probably watching who will be interested on some of the questions you ask.
Okay.
Okay, yeah. After this. Okay, so there you go, guys. You've been listening to Dr. Samuel Aladejare. He's a psychiatrist, and of course, he works with the Federa Neuropsychiatric Center Hospital in Yaba, Lagos. So we've been talking about how much of effects COVID-19 have on us mentally. Yes, the mental health consequences of this. So now he is about to just have a counseling session with me. Uh, at least he's probably going to be doing this virtually more often now. This is going to probably become the new order. So, sir, you the floor to you. Go on. I'm
All
ready.
right. So,
I'm your patient.
well, before I go on, I'd like to say that there are ethical there are ethical considerations to this, and because of that, I may not be able to I may not be able to go full scale because
Yeah.
of the ethical considerations. So we won't want to be seen. If we have to do teleconferencing, there are agreements that we have to go ahead. There are things that people have to understand and be able to consent to before we go ahead. So because of that, I won't be able to do that. So what I would do, pardon me, is to do a general counseling, more like a general counseling at this time for people who might be going through one distress or the other as a result of the new normal, like you mentioned, that we find ourselves. So it's possible that people find themselves at home, working from home, especially, and in working from home, after working from home for some time, it's possible that you may begin to feel is it generally unwell. You may not feel too okay because you are expected to move around, to you are used to going out, coming back every day, but now you just stay back in the house, sit back, you are not discussing with anybody, you are just in the house, and you are more or less working from home. So that could affect your mental health. With time, you could begin to look at the world in a different way. It could cause depression for some people, clinical depression, or the emotion of depression, where you just begin to feel sad generally. And then it could make you anxious, generally anxious, and it could affect your interactions going forward with people. For instance, when you spend too much time at home, when you have to leave the house to meet people, when you have to leave the house to meet people, you could start getting anxious because it's not something you've been doing regularly. So what I would advise for as many who are working from home is that in as much as you are working from home, spend time also to exercise if you could. I know that people are encouraged to stay at home as much as possible, but if you could spare maybe 30 minutes or for 30 to 45 minutes in the morning or in the on the night to do some exercise, if it's jogging, and if you cannot even jog, you can walk. You can walk for, let's say, 2 or 3 kilometers, 2 kilometers. Just walk and come back to your house. It will make you feel better. And then you should, in addition to that too, you shouldn't just staying glued to the system for a long time. Could be mentally draining and also physically draining. So after you hold meetings, maybe 1 or 2 hours meeting, you may want to put down your devices, walk around the house, stretch a little, but it's good for your physical health. It's good for your mental health as well. It refreshes you as well. So these are things, and then try as much as possible not to have too many meetings in the day, because you may now feel that since you're at home, you're not going anywhere. You start going from meetings to meetings, first one, 2 hours, 3 hours, and you're just doing that online every hour. You think everything is all right. It may not be a very healthy way to live. So you may have to as well restrict those meetings to what is just okay, what is just bearable, so that you don't overstress yourself. Because we've learned that spending time with gadget generally is mentally draining. It drains you mentally, it drains you physically as well. So you may have to sort out time, and you may have to schedule your time properly so that you can accommodate everything. So if you are going to use the system and you have something to do, maybe you have a book to read earlier on, you may want to read the book first before you do that, because by the time you are through with the system, you'll be so tired and mentally drained that you can't do any other thing in the course of the day. So these are some of the measures you might want to take. And then eat well, rest well as well. That you're at home does not mean that you can cheat sleep. You still have to get some nice rest while you are at home, and then eat well, worship well as well. Prayer is good for the mind. It instills hope, and we know that in hopelessness is a forerunner of depression and suicide. So when people have hope, have God, they have hope in their life as well. So I also encourage people to do that. Use this time to deepen your faith as well. So that's what I would advise during this period, generally for anybody working from home. And if you
Okay.
think things are beyond you, you cannot handle it alone, you may have to contact a professional for professional help.
Okay. Dr. Samuel Aladejare, we want to thank you very much for your time. Ladies and gentlemen, we've been speaking with Dr. Samuel Aladejare. He's a psychiatrist, and he works with the Federa Neuropsychiatric Center Hospital in Yaba. Thank you very much, Doctor,
You're welcome.
for joining us on the program today. Thank you.
You're welcome.
Okay, so guys, this is where we are going to end it for today. I want to say thank you very much. That is my daughter. She just walked into the camera, and of course tomorrow on the show it's going to be you and I. We are going to do it together. We post a link where you can join in. Let's talk tomorrow about some of the conspiracy theories you've heard about COVID-19. So tomorrow, now the conspiracy theories we just want to talk about. So I hope you join, and I hope to hear from you. Yeah, because different theories don't fly about COVID-19. A lot of things happening on social media. So we'll look at all of that together. So thank you very much once again. My name is Twitwi Ayenowowon. 30 minutes again with me tomorrow, even though it's not the past 30 minutes now. But tomorrow, no guests, so it's just going to be me. So 30 minutes, of course. Then on Friday, we have the hangouts. I have Kelechi Nkoro, Dr. Squared, and all of the guys who will be joining us from their respective places. And on Saturday, me and my wife, or my wife and I. So thank you very much for your time. My name is Twitwi. Do have a wonderful day.